Patients who are not breathing or whose breathing is inadequate will require assisted ventilations. The least sophisticated and easiest of these procedures is accomplished using a pocket mask and your own expired breath. The primary advantage to a pocket mask is its accessibility. A pocket mask can literally be carried in a pocket or on a keychain, and yes, even in a jump kit or first response bag. And while simple, the pocket mask should not be minimized as a viable ventilatory device, since with supplemental oxygen, the pocket mask can deliver oxygen concentrations and tidal volumes consistent with a bag valve mask. The pocket mask has a clear face mask with a one-way valve that prevents the patient's exhaled breath from exiting the valve. While your face will be close to the patient, you will not exchange any breath or secretions with the patient. Many pocket masks also have an oxygen inlet port, allowing supplemental oxygen to be attached. You will need the following equipment: BSI to include gloves and goggles, and a pocket mask with a one-way valve. Suction would be great to have on hand, and if available, an oxygen tank, supplemental oxygen tubing, and regulator. When use of a pocket mask is indicated, follow these steps. Take BSI precautions. Position yourself at the head end of the patient. It will be a matter of personal preference whether you sit above the patient's head or to the side. For medical patients with no indication of spinal injury or trauma, open the airway using the head tilt chin lift maneuver. In a situation where there is an indication of trauma or spinal injury, open the airway with the jaw thrust maneuver instead. Clear the airway if necessary using a finger sweep for unconscious patients or suction if it's available. Insert an oropharyngeal or nasopharyngeal airway if available. Connect oxygen tubing to pocket mask oxygen inlet port if one exists on your device. Turn the oxygen regulator liter flow gauge to 10 to 15 liters per minute. Center the pocket mask on the patient's face so the triangle shape is over the bridge of the patient's nose, and the larger, rounded portion of the mask is between the lower lip and the chin. While holding the mask firmly in place, place your thumbs over the top side of the mask and place your little, ring, middle, and index fingers on the patient's mandible, near the angle of the jaw. Simultaneously, using the index, middle, ring, and little fingers, pull the jaw upwards toward the mask. While making a seal with the mask to the patient's face, take a deep breath and exhale into the one-way valve at the top of the mask. Adult ventilation should be delivered over 1 second, and the rate of ventilation should be 1 breath every 6 seconds. Children and infants' ventilation should be delivered over 1 second, but the rate of ventilation should be 1 breath every 3 seconds. Remove your mouth from the one-way valve during each of the patient's exhalation. Allow complete patient exhalation between each breath so as not to compromise circulation. Do not overinflate the lungs or ventilate too rapidly. You should only breathe enough air into the mask to see visible chest rise. If you notice fluids or vomit in the clear face mask during ventilations, immediately discontinue ventilation and clear the airway, including suctioning if necessary.